Hello, welcome to Zoonosis with Joy. I'm Joy, and today we're going to be talking about therapy horses and autism. Thank you to all the new subscribers. It's good to meet you. If you're new to the channel, I talk about animals, health, and society. And I know I said I probably wouldn't do another horse video for a while. I asked the people on Twitter, and they voted for yes. So we are going to do another horse video. I'll probably do another couple, see where it goes from there. This video is specifically going to be about horses in a contemporary context, but I'll talk a little bit about history as well. So first, let's start with what is a therapy horse and what is therapeutic horseback riding. Well, horses have been used for medical therapy since the time of Hippocrates, and likely before. Hippocrates did prescribe horseback riding for chronic ailments and believed that it would be helpful for a number of different conditions. In modern times, horseback riding has been used since the 1950s for chronic medical conditions. This kind of began in the 1950s with Linz Hartel, who was a Danish woman who contracted polio. And over the course of several years, she managed to regain a lot of her muscle strength and ability back by horseback riding. She eventually went on to win an Olympic medal in dressage. So then it became something of a more popular notion and has been used for a wide variety of different conditions. Everything from post-traumatic stress disorder, anxiety, depression, cerebral palsy, multiple sclerosis, and as we'll see, autism. So it is quite a wide, varied thing that they use it for, but essentially what it involves is often a combination of therapeutic horseback riding as well as animal-assisted behavioral therapy, basically. So bringing in an animal so that people can interact with it, and often there's a physical component with the riding as well. Let's talk about a little bit about autism. What is autism? Autism is also known as Autism Spectrum Disorder in the Diagnostics and Services Manual. And essentially, it's a neurodevelopmental condition, meaning that it starts in childhood and develops over the course of the lifetime and doesn't go away with adulthood. It's a spectrum disorder, meaning that it can have multiple different presentations. It typically shows up with three major characteristics: social deficits, communication deficits, and stereotypical or repetitive behavior. This can really present differently with each individual. Each individual with autism is different, and they all have different challenges. Autism also typically represents with a multiple other constellation of disorders, everything from stress, anxiety, depression. There's often difficulties, comorbidities such as like OCD. There could be even things such as sensory sensitivities, which is a very common presentation. And some clinicians have said, that might be a defining characteristic is honestly sensory sensitivities, but that's neither here nor there. We'll get into this a little bit more. There's not really any good treatments for autism. You just kind of have autism. There's been a number of things that have been tried, and we'll get into that in a minute. But one of the things that's been suggested is therapeutic horseback riding. Now, I'm not sure how many of you are familiar with Temple Grandin and her work, but she's very famous as an animal behaviorist, and she worked extensively for animal welfare, specifically with reforming abattoirs, slaughterhouses in the United States and improving their welfare because, in the last moments of animal life, it's very stressful. You bring them into a dark room and there's lots of loud noises and that sort of thing. And she was really the first to advocate for these animals in these last stages of life and make a case that there was an economic benefit to it. I have her book. This is Animals in Translation. So if you haven't read it, definitely check it out if you haven't had a chance. I'm going to read a short snippet from it because in her own childhood, she actually has autism, and she discusses how horseback riding was beneficial for her. Horseback riding was joyous for me. I can remember being on horse sometimes, and we'd gallop in the pasture, and that was such a big thrill. Of course, it's not good for horses to run them all the time, but once in a while they'd get and have a little run, and I'd feel exhilarated. Or we'd be out on trail riding, and I'd do a really fast gallop down the road. I remember what it looked like, the trees whizzing by. I remember that really well to this day. Riding becomes instinctual after a while. A good rider and his horse are a team. It's not a one-way relationship either. It's not just for the human relating to the horse and telling what to do. Horses are super sensitive to the riders and are constantly responding to the rider's needs without being asked. School horses, the horses a stable uses to teach people how to ride, will actually stop trotting when they feel the riders start to lose their balance. That's why learning to ride a horse is completely different from learning to ride a bicycle. The horses make sure nobody gets hurt. The love a teenager gets from a horse is good for him, and so is the teamwork. For years, people always said that you need to send difficult kids to military school or the army. A lot of time that works because those places are highly structured, but it would work a lot better if military schools still had horses. So Temple Grandin found a lot of solace and a lot of therapy. I mean, therapy in the broadest sense of the word. She found a lot of comfort and companionship with the horses and found that she could relate to them quite a bit. And she would use this sort of connection she had with animals later on in life. What are the data-driven things? What are they saying about this equine-assisted therapy? Well, most of it's pretty small scale at this point, but the evidence is promising, at least for a short-term intervention. Several of the studies that I will link in the description discuss how over the course of something like 8 to 10 weeks of riding lessons, the children and adolescents with autism had improvements in social behaviors. They had less stereotypical behaviors. They often had improvements with cognition and remarkably lowered stress levels. And there are a few different explanations, nothing really concrete as to why this works. One of them is that horses are very sensory friendly. Horses move very rhythmically. They're quite quiet. They're quite warm. So there is some sensory benefits, especially if you have sensory problems. You're outside and working with an animal that's quiet and warm and moves rhythmically. It's really good for children with autism that way. There's also the fact that horses don't talk. So your social communication is mostly physical, with the reins, with sitting on the saddle, the attitudes that you take towards the horse, approaching the horse. They're very specific rules, and the way that you approach a horse is basically the same every single time. You don't run up straight to them, you don't yell at them. You approach them from the left side and you interact with them by touching them. You don't really talk that much. It's very much a straightforward social interaction. So there is benefits that way too. There's also the fact that horseback riding confers a lot of confidence, and this is something that's really emphasized in the literature. Horseback riding is really just controlling a large animal, using your commands and using gentle guidance. And that control and ability to master an animal, to have that communication and that interplay with another animal, it's a huge confidence booster. And so it works really well for kids who may not have that confidence growing up in life. So it's a really important thing that way. But what about the horses? And is this good for the horses? Is this bad for the horses? Well, the signs are pointing they don't really have a lot of evidence at this point that it's bad. I mean, obviously, it really depends on the individual horses here. So you have to think about, for these kind of programs, you want horses that are what they used to call bomb-proof, or, better term may be, less bomb-prone, so they're not going to overreact to loud noises or sudden movements. Obviously, the kind of horses you want working with children, especially children with neurodevelopmental conditions, maybe cognitive deficits, that can really depend on the selection criteria for what horses you're using for these programs. Horses, of course, need to have good housing and good pastures, so making sure that they have adequate access to that when they're not being ridden, making sure that interactions are controlled, and you have someone who's a lot of experience working both with children who have these conditions like autism, as well as horses, have a lot of experience working with horses as well. And finally, you need to have a good plan for what to do with the horses once they are no longer able to be ridden. So a retirement plan, some sort of way to make sure the horses aren't just sold to a feedlot somewhere up in Canada. So that is one of those things that, there's multiple different angles we look at for this. But I mean, if you look at Temple Grandin's work, she says that, horses quite enjoy, occasional being ridden hard and running and that kind of exercise. So there might be some good benefits for the horses. We don't have a lot of strong evidence either way. That being said, obviously, I'm the kind of person who has autism. That's pretty evident based on my channel. But, from my personal experience, animals are one of those things that, they don't judge you. They don't yell at you. They don't expect you to dress or conform a certain way. They have very relatively simple rules of interaction, and they don't judge you. So, I mean, it's pretty obvious why animals are beneficial for people with autism. They reduce your stress threshold, they reduce your cortisol, So having access to animals and having interactions with animals for people with autism all over the spectrum is a good thing. There are no good drugs for autism. There are no good pharmaceuticals on the market. There are no good therapies, really. One of the therapies that have been commonly used for the last 50, 60, 70 years, called ABA, Applied Behavioral Analysis, was built on the behavioralist school of Skinner, like the Skinner box, and you do operant conditioning where you reward good behaviors and you punish bad behaviors, was really focused on the behavior side of autism. What was an undesirable behavior, someone having a meltdown, someone doing these kind of things. And this focus on behavior led to a lot of abuses and still does. So I'll link a paper in the description that talks about this. The long-standing benefits are minimal, if any. And children often come out of these programs, with post-traumatic stress disorder. They are mistreated, and they often use physical violence or physical restraint on children. And they also use reward and punishment schemes that we wouldn't use even on animals. This is something that, still goes on to this day. So when we're looking for new therapies for treating autism, really we should be thinking about making the individual's lives better rather than trying to correct problem behaviors. And hopefully equine-assisted therapy, maybe more data will come out to show that this is beneficial that way. But if it doesn't, then we just took a bunch of children and gave them riding lessons and have the insurance pay for it. Is that the worst thing in the world? I mean, I don't think so. You gave these children a chance with good, fond memories and a chance to build up their confidence, and you're not going to cure autism. There's no cure for it. We are the way we are when we're born. I think I'll want to finish this video off by reading something else from Temple Grandin here. And, she's done a lot of good work. I mean, I would be critical of the way that she supported the beef industry personally, but that's just me. So I just wanted to finish it off here. I hope this book will help regular people be a little less verbal and a little more visual. I spent 30 years as an animal scientist, and I spent my whole life as an autistic person. I hope what I've learned will help people start over again with animals, and maybe with autistic people too, and begin to think about them in a different way. I hope what I've learned will help people see. So, thank you for watching this video, and I hope you enjoyed. There's still room on the on horses courses that I'm starting in June 10th. 6 sessions, and there's 2 hours per session. It'll be a lot of fun. If you want to sign up, I'll put the sign up link in the description, or if you want to ask me questions about it, that's also okay too. There is a rebate if you do attend all the classes and you do all the readings and you show up. I would love to see you there if you're still on the fence about it, but if you have questions about this video or comments, if you want me to do something else, please let me know. I made this video specific because Deb W suggested that I make a video about service animals, and I figured that this kind of covered a little bit of that, but please throw me any comments or questions your way. I hope you enjoyed. Thank you and have a good one. Peace.